Hi all, today I'm going to talk about early graying of hair or premature graying of hair. There have been many queries regarding this, and so I just want you people to have a clear idea about what it is actually and what causes this and whether it can be treated or not. So graying of hair is okay after late 30s or early 40s, so that is what we accept as normal. So what is premature graying? The grey hairs start to appear at a very early age, say around when for people who are in their 20s or even those who are in their teens, and there are even some children who develop these early graying of hairs. So what are the main causes for this? So a genetic predisposition is a very important cause. So if your parents have had early graying of hair, say if they've had graying of hair in their 30s, then chances are you might get graying of hair much earlier than that, say late 20s or so, or even during your teens. So that cannot be controlled, but once the early graying starts, we can sort of intervene and try to slow down the process a little. So other main causes are vitamin deficiencies, most important of which is B12 deficiency, and of course zinc deficiency, and calcium to a certain extent. So and there are other reasons for early graying of hair in those without a genetic predisposition, such as increased stress levels, both physical and mental stress levels. So if you're working late hours, there is lack of sleep, if you're into a lot of stress and tension, or if you've undergone any major medical illnesses or some surgeries as such, this can affect the hair growth and also cause some premature graying. And one other thing is use of harsh chemicals or compound shampoos which contain some chemicals which can strip your hair of their color. So this graying of hair actually occurs because there is a reduction in the pigment production. The pigment is melanin, like that which is present in the skin, it is also present in the hair. So a reduction in this pigment production or a destruction of the melanocytes which causes this pigment production can result in graying of hair. And another very important reason for graying of hair can be excessive exposure to UV rays. So if you're out in the sun for a very long time, try to cover your hair with a scarf or a cap to protect your follicles from such damage. And there have been some queries regarding this premature graying of hair. One person had asked whether smoking can cause graying of hair. Yes, definitely smoking is a very important factor. This can cause early graying of hair. And one other person wanted to know whether any medical illnesses in the body can cause early graying of hair. Yes, anemia and deficient thyroid hormone can cause early graying of hair. So again, anemia due to any vitamin B12 deficiency can cause graying of hair. And the third most interesting query was whether plucking of these grey or white hairs can cause other hairs to become white. Some sort of milk from these hairs which spreads on the other hairs and cause graying. All this is an absolute myth. There is no milk as such which comes out from the hair follicle. So if you're going to pluck a grey hair, it is going to grow back as a grey hair. It won't grow back as a black hair. So in case you have to attend an event and there are a lot of grey hairs showing up, maybe the ones which are visible outside, you can just pluck it off. So it's absolutely safe to do it. And generally, the plucking of a grey hair is not going to induce new white hairs around it. So you needn't worry about it. So the first step in treating this condition is to identify the cause of this premature graying of hair. So in case there is a lot of vitamin deficiency or zinc or calcium deficiency, then we can supplement with certain pills which can bring back this color to your hair or induce this melanin production. And your stress levels of course play a very important role. So it is up to you to control your stress levels to a certain extent and have a good 6 to 7 hour sleep. And foods rich in antioxidants will also help you to overcome this problem to a great extent. If there is a genetic predisposition, if your parents have had this similar condition during their early 30s or 40s, then chances are this is going to be a progressive problem with you. So come into the dermatologist office as early as possible. So the fewer number of hairs, the greater the results with a proper intervention. So there are certain gels and medications which can slow down this process a little and which can induce the pigment to a certain extent. So, will there be specific or will there be excellent results following treatment? Yes, in some cases where there is a vitamin deficiency. So, just supplementation with proper vitamins will help you overcome this problem, and hairs which are partially grey will completely get back their full color if intervened at the right moment. But hairs which have gone completely white, which have lost their pigment entirely, it is very difficult for them to get back their color, because at the root level they have lost all their pigment. So, as soon as you find signs of early graying of hair, visit your dermatologist as early as possible, so there is time for us to intervene and control this problem to a great extent.